Medical experts in India are noticing a big rise in a problem which is in fact very silent. You and I may not even know, but we could be suffering from fatty liver disease because 1 in every 3rd Indian is suffering from fatty liver disease. It could be any of us. Experts also talk about how this is striking early. Younger Indians are being diagnosed with fatty liver disease. So what's really going on? What are the symptoms to watch out for? How can you prevent it? What are the solutions to this problem? This report has it all. It's a disease striking Indians early. It's striking children. It's a silent epidemic. A study by AIMS says that 35% of Indian children are affected by fatty liver disease. AIMS says approximately 38% of the Indian population is afflicted with fatty liver or non-alcoholic fatty liver disease, which is NAFLD. That's 1/3 of every Indian. So what is fatty liver disease? Fatty liver disease occurs when fat builds up in the liver, primarily triglycerides and other lipids, making up about 10% of the liver's weight, potentially leading to liver damage. And why does that happen?
So fatty liver in simple terms is presence of extra fat in the liver, and we traditionally in our doctor's terminology used to call it non-alcoholic fatty liver disease. In these patients, it was said that there is no presence of alcohol in causing fatty liver. So fatty liver can happen in any individual who can have some few reasons. Most often we are seeing in patients who are overweight or have additional factors, can be diabetes, can be high cholesterol level, can be high blood pressure, can be insulin resistance. So now the terminology has been changed to MASLD or MAFLD, which is metabolic dysfunction associated fatty liver disease.
Well, there are two main types of fatty liver, NAFLD and alcoholic fatty liver disease, mainly caused by heavy drinking. What then are the risk factors of non-alcoholic fatty liver disease? Children and young adults who have high body mass index or BMI, have central obesity, are insulin resistant, have prediabetes or have type 2 diabetes.
Metabolic dysfunction is a multifactorial metabolism disorder in some individuals. In some individuals, it can be just diabetes type 2. In some individuals, it can be, a disturbance in the lipid profile, which means increased cholesterol or increased triglyceride level, especially triglyceride level, which can cause fatty liver disease. Increased waist circumference, which is in international criteria more than 85 centimeters for men, more than 80 for women. That's one factor which is seen, and we can define this as coming into the metabolic syndrome, or who have high blood pressure along with it, which is hypertension, or have obesity with it. These patients have a higher likelihood of having fatty liver disease, which is non-alcoholic fatty liver disease.
Poor lifestyles, mostly consumption of processed food, is seen as a major reason behind fatty liver disease. And that's why it's striking early.
We are seeing the prevalence of fatty liver disease is increasing exponentially every year. And I see that the prevalence is rising in the children population, the pediatric population, and also in the younger population. And the biggest factor is definitely lifestyle. The kids are exposed to a lot of processed foods. The culture of eating out and food delivery has increased exponentially in last 5 years, and we've seen the ease of ordering food at home from your app on your mobile is so easy. The ease of availability of packaged food, which is frozen, which can be heated and eaten up. Very few youngsters would take the trouble of cooking themselves a meal and choosing a healthy meal over, just a comfort and convenience of getting a meal delivered at home.
Fatty liver is the starting point for several metabolic diseases, such as type 2 diabetes, heart disease, and even hypertension. But the good news is that lifestyle changes can reverse it.
Now, lifestyle modification begins at home, but most of the patients which I get, they want an easy fix. They want a medicine to treat it. So some patients who where the fatty liver disease is purely because of lifestyle problem, they need to start adopting a healthy lifestyle. And the first thing that comes in healthy lifestyle is cleaning up your diet, cleaning up the wrong carbohydrates in your diet, cleaning up sweets, fried food, and carbonated beverages. Even the factor that people are used to buying juices which contain loads of sugar, that is a wrong culture. Fresh juice versus box juice is different. So I would say the first thing that begins at home is cleaning up your diet.